been made in the last year. So we have Dr. Rina Das, the Scientific Program Director at NIH's National Institutes on Minority Health and Health Disparities. Last year, we had a wonderful special emphasis panel on sleep health disparities. I see Dr. Granier on here today, one of our panelists from last year. And so we're excited to get a different point of view this year from Dr. Rina Das. And we did get a video. She was not able to join us today in person. So I will go ahead and pull up her video.
Hi, everybody. My name is Rina Das, and I'm the Director of Division of Integrative Biological and Behavioral Sciences at the National Institute on Minority Health and Health Disparities, or NIMHD. I would like to thank the organizers for inviting us to this very important topic on sleep. Today, I'll share information about our institute and our interest in sleep research. Something about our institute, we are a fairly new institute. Last year in 2020, we celebrated our 10th year anniversary of NIMHD. So our mission is to support research on minority health and health disparities, to basically understand some of the underlying causes of disparities and design interventions to reduce and eliminate them. The populations of interest for our institutes are the racial ethnic minorities in US, along with populations with low socioeconomic status, rural population, and sexual gender minority population. Besides research, our mission is also to support training to increase diversity in scientific workforce. We also collaborate with various institutes at NIH to promote minority health and health disparities research. One thing I wanted to emphasize that like other institutes at NIH, we are not focused on any particular disease or condition. So we support research in all health conditions or diseases where there is a health disparity in the population. I wanted to talk about our interest in sleep research. So why are we interested in sleep? So when you look at the literature, sleep deficiency appears differently in various different racial ethnic minorities and underserved population with low socioeconomic status. Racial ethnic populations seem to have the highest prevalence of sleep deficiencies, which include shorter sleep duration, poor sleep quality, and sleep disorders. If you look at the table on the right, it's data from CDC that shows the prevalence of short sleep duration was much higher among Native Hawaiian and Pacific Islanders, with the 46.3% and lowest among white population. Sleep patterns have been shown to vary by socioeconomic status, by level of education as well. In one of the studies from CDC, they show that populations with college degree or with employment have better sleep quality and better sleep duration compared to unemployed respondents. So the causes of these sleep disparities are quite complex, and it could be due to some of the social determinants of health, which are also well known to play a role in health disparities. Some of them are social, cultural factors, environmental factors, racial discrimination could be a mediator, neighborhood factors, suboptimal housing, exposure to noisy environment, sleep environment, residential segregation, and exposure to other stressors could be playing a role. A recent paper also really suggested that racial discrimination could account for some of the disparities in insomnia. So the question is, what are some of the causes of these disparities that Here, also socioeconomic status influences sleep. Black and Latino men were more likely to report sleeping less than 5 hours per night compared to white. Blacks had 32%, whereas whites reported 12%. Similarly, when you look at the graph on the right-hand side, the socioeconomic status, low and middle socioeconomic status men were more likely to report poor sleep, shorter sleep, compared to people with upper level SES. So these sleep patterns are also correlated with various health outcomes that have been measured. And what is striking is that the sleep deficiencies that we see here and the determinants could be very similar to what we see in health disparities research, where we have quite a bit of evidence showing socioeconomic status, race, education level impacts health. So here is a slide that shows you an example of how socioeconomic status or household income affects health and mortality rates in US. This data shows that the annual household income is important for mortality rates. Your chances of dying are 3 times higher if you earn $25,000 or less, which is on the leftmost bar, compared to the rightmost bar over 100,000. So you can see a clear gradient how income plays a role in health and health disparities. So another social determinant of health is the place where you live. Geography is very important. So this map here on the left shows the prevalence of sleep. So short sleep duration, which is less than 7 hours for adults, varies by county, and it matters where you live. As you see here, the prevalence of short sleep is clustered around this southeastern of United States along the Appalachian Mountains, which are shown in dark brown color compared to the lighter yellow color. So this data that shows that geography plays a role in sleep disparities. And if you look at the prevalence of heart disease, which I have shown you on the right-hand side, which again has the darker color means higher prevalence of heart disease and mortality rates from heart disease. So it kind of matches very well in terms of the prevalence of poor sleep with prevalence of death from heart disease. And you can put similar maps for other chronic conditions and they match very well. So the question is, what are some of the causes of sleep disparities that we observe? And as I mentioned earlier, that social determinants of health we feel could be playing a role, and it could be influence of racism and structural racism. So NIMHD, in collaboration with various other institutes, really led an effort to promote research to understanding the causes and health consequences of sleep disparities. In 2017, we issued a funding announcement, PR 17-34, which was reissued in 2020. What we are looking for is to really improve the understanding of some of the underlying causes of sleep disparities in various racial ethnic minorities. And we wanted to look at both risk factors and protective factors. And we definitely wanted to have people focus on social determinants of health, how those determinants influence sleep, and how they influence various health outcomes. So in response to that funding announcement, we got a really great response. We had a wide variety of applications that focused on not only African Americans, but American Indian, Latino population, Filipino immigrants, rural, urban, and low socioeconomic status population. So in terms of the health conditions that were covered also in this funding announcement were quite broad, both from mental and physical health. I just wanted to share with you some of the selected applications that were funded that we received in response to this funding announcement. As I mentioned, that the socioeconomic, social conditions are very important. So structural racism, as you see here, one of the application is trying to understand police use of deadly force in African Americans and how that can affect sleep health in African American population. So there were other applications that are looking at various other stressors. So in Filipino immigrants, what are some of the psychosocial stressors, environmental stressors? As the immigrants migrate to this country, what are some of the acculturative stress and how they play out in sleep? So we are really excited to see the response that we received. Besides these funding opportunities, we also have at NIMHD, regular parent RO1 and other funding mechanisms where we support sleep research. We are funding a variety of sleep research on school-based health centers for children. We are also looking at acculturation in Asian Americans, especially we have a funded study on Asian American looking at the anti-Asian sentiments that have recently been shown to play a role in our society. So how does that affect sleep? So we are waiting to see the results, and we'll continue to see more interest in sleep disparities research who are incorporating these social determinants of health. I wanted to share a few resources as well that might be of interest. We had organized a workshop on causes and consequences of sleep health disparities in 2018 in collaboration with National Heart, Lung, and Blood Institute and OBSSR, Office of Behavioral Social Science Research. And we brought in experts from sleep research, from circadian rhythm, and from health disparities research to really collaborate on this effort. The workshop report was published in the journal Sleep in 2020. And the report really distills out various ideas and 5 areas and 9 strategies. So please do check out the report and look at some of the recommendations. Basically, we're trying to integrate sleep researchers with health disparity researchers and see if we can implement some of these social determinants of health, develop new interventions, and also build infrastructure and training for the next generations. Here is another resource that I thought would be worth mentioning. This is a Phoenix Toolkit at NIH. Since I mentioned that social determinants of health are so important, this toolkit was designed to really come up with standardized measures for measuring social determinants of health. So this is a culmination of a number of years working with other institutes at NHGRI and other institutes at NIH, along with NIMHD, to come up with 19 new measures for structural social determinants of health. And this is, again, really trying to emphasize some standard measures for researchers. I just wanted to share information on how to connect with us. If you want to learn more about our institute, learn more about our programs, please do visit our website and visit our social media channels. And I'd like to thank you for your attention. Thank you very much. Bye.
Okay, so another wonderful presentation, really excited and really encouraged from our presenters so far talking about the federal investment in sleep research.